There's people in healthcare who want to use technology, and there's people in technology who want to make a difference in healthcare. Hacking Health came together by saying, okay, let's put these two groups together and let's see if we can get them to start working together. So it's not about thinking about or whiteboarding or coming up with a committee to come up with a solution. It's like, well, let's get our hands dirty and actually try and hack together a solution. Hackathon's a great way to test an idea very quickly, get a prototype that then can be a tool to further refine the idea and get more support, get a pilot going to get these innovations from the ground up actually into the hospital and being used.
I think what Hacking Health does for the students at the U of A is exposes them to many different minds, from computing science, designers, developers, different programmers, and realize that a health team can be so much bigger than just health professionals. And it does allow them to be agents of change and can see how they will be leaders and can make some real major differences in the health system.
I think in Edmonton we have all the ingredients to be innovative in healthcare IT. I think we have great natural resources in Alberta, but we also have great human talent as well. And Edmonton being the center of northern health, we have a lot of challenges that have given us an innovative spirit, and I think we can capitalize on that innovative spirit. We've only been doing this for, like, I would say less than 2 years, and it's amazing the uptake that we've gotten. When we first planned this in Montreal, we thought it was going to be 30 people in a room, maybe more like a seminar, some of the traditional things that happen. It ended up being 300 people, and then we started getting calls all across Canada to do this, and now we're doing it. We have events planned in Boston, New York, in Hong Kong.
These kinds of ideas are sort of turning the world over on its head and saying, how can we improve the healthcare delivery that we deliver to Albertans?
We need to innovate differently in healthcare. We need to try something differently, and we've tried the top-down approach, and there's a place for top-down approaches too, but there also needs to be a place for people who are at the front line to also be able to have an avenue to innovate from the bottom up.